written responses at the end of the webinar in a couple of days to everyone who joined, or to your colleagues who were not able to join the webinar today. We will also, during the presentation, during the webinar, ask you some questions. So be prepared to answer some of the poll questions that we will have for you, just to learn a little bit more about your experience that's relevant for today. So before I will ask Michael to start the webinar by taking a look at what you can expect on the data tracker, we want to ask you if you have visited the COVID-19 tracker yet. So I will open the poll, and please tell us whether you've seen it or not. Please be honest. It's okay if you haven't seen it yet. That's why we're having the webinar today. So yeah, one or a few more seconds too. All right, I think everybody is answering. Okay, one last second to give you a chance. All right, let's close the poll and see. Okay, the poll is closing momentarily. All right. And is everybody able to see the results? Michael, are you able to see the results?
Yes, thanks, Diana. Thanks for that.
All right.
There's about 47% that haven't seen it. So let me just start by just giving you a sort of high-level introduction to the tracker itself. All right, so on the tracker, it's a public good, so it's a free-to-access website. The website is on the presentation itself, so it's www.covid19tracker.africa. And at the moment, there are 5 African countries. Zambia and Ghana are still on its way. Data collection is still getting done. So for Kenya, we have 3 waves of data currently in the interface. For Nigeria, there's 3 waves as well. For Rwanda, 3 waves. South Africa, 3 waves. And Uganda, 1 wave. There's going to be other waves getting added later this week. So this will add to the current tally. On the tracker itself, the tracker is broken down into each country. It's broken down into 6 categories. So if you go to, say, Kenya, you'll be able to access health being 1 category, financials, food security, safety, earnings, and demographics. Within each of these categories, there's multiple indicators that go underneath each category. But Petronella would go further into detail of what indicators go into what category. So those are the main sort of categories for now. There's on the interface itself, you'll have the ability to filter the data. So for this webinar, there's a big interest into women or gender. So with the demo that I'll be doing later on, I'll be using the filtering capability, but there's other filters that you can use as well. So there's for gender, there's man, women, geographic area, there's rural and urban. You'll be able to filter within a jurisdiction or a province within your selected country, and you can filter by certain age groups. You can also do multiple filters. So in the demo that I'll be doing later on, you'll be able to filter by, say, women and rural in a certain age group, and then only that data that's applicable to what you've selected appears. The tracker itself is all based on widgets. So what a widget is this little block. There's multiple widgets, and within a widget is an indicator. The 3 most common sort of graphs that are used throughout the tracker are these 3 graphs, which is a timeline series, which is the first one. And this breaks the data down by waves. The point on your far left would be the first wave. So the first wave is when the date which it got collected, which is first, and then it'll be followed by the second, third, fourth, and etc. The second most common graph is called a stacked timeline. It works very similar to the timeline series. The only difference is that instead of just representing a line, the whole sort of chart gets filled and it gets represented by 100%. And then the third one, which is on your far right, is the stacked bar chart. And this also, every bar represents a sort of wave in the data collection. Within each widget or block, there's a share button right at the bottom left, and that gives you the ability to share that particular widget on social media. So if you select share, you can share it on Twitter or Facebook or whatever social media you prefer, or you can embed that widget directly onto your website. So it comes with a embedded code. Then the other thing that we've added, so if you do mouse over a particular node on the timeline, a tooltip will appear. So what that is just a little block, and that just gives you the description of where or what you've selected on the particular graph. So in this example, on the stacked timeline, I've moused over this graph on wave 2, and it tells me that the respondents in dark blue are yes, and the ones in light blue are no, and it breaks the percentages down for you. And then later on, I'll be giving you a demo, but it's quite crucial to remember these sort of how the widgets actually do function. And that's it for me for now. And yeah, I'll get into a more descriptive demo later on. Thanks.
Great. Thank you, Michael, for giving us a flavor of what data users can expect on the portal. And we'll invite Shirley now to tell us a little bit more about the data collection methodology and also within the context of the work of FinMark Trust and Eye to Eye. Thank you, Shirley.
Thanks so much, Diana. Okay, so I'm going to take you back a little bit away from the tracker and just tell you a little bit about the work that we've done up to this point to get to where we are. So FinMark Trust is the financial sector deepening agency for the SADC region, and our mandate is to make financial markets work for the poor by promoting financial inclusion and regional financial integration. We do this by conducting research to identify the systemic constraints that prevent financial markets from reaching the financially excluded, and also by advocating for change based on research findings. So we're very embedded and grounded in the use of data. And several years ago, FinMark Trust, in partnership with Sense, we created the Insight to Impact facility as a global resource center to really help develop the use of data in financial inclusion research. And this was funded by the Bill and Melinda Gates Foundation and the MasterCard Foundation. And then within the Insight to Impact facility, I'll tell you a little bit more about the work that I have been doing for the past few years and that we're now taking forward as FinMark Trust. So we really began our work focusing on sustainable data collection. We really wanted to think about how do we get data for financial inclusion that is more affordable, can be collected more frequently. I'm sure those of you that work with data a lot know that to get nationally representative samples of data collected is both logistically a very big task, and it's because of that logistic task, it takes a lot of time and it also costs quite a lot of money. So our mandate was really to try and find alternative ways of actually getting to good data. And so I started working on pilots for sustainable data collection. And these pilots were really focused on using mixed methodological research. So we wanted to see if we could use different methods of data collection to face-to-face. So traditionally, A lot of our surveys are done in person because that way we know that we're getting to a good representative sample because we can use probability sampling. But this, of course, costs a lot of money, so we wanted to see if there was a way we could leverage the use of technology, particularly mobile phone technology, and be able to create the same outcome, get the same results using technology as we would using a good face-to-face survey. So we did many tests, and we tested using SMS surveys, which are self-completion surveys, where the SMS is sent to the participant. The question is in the SMS, and they reply with an SMS message, which triggers the next question. We also tested using telephonic interviews. We have an interviewer who calls the respondent, and they talk over the phone. And what we really found was that the inclusion of a small face-to-face sample really was helpful for making sure that we were reaching all cohorts of interest. So we worked on developing a model that could allow us to do mixed methods of data collection and to get as good results as we see using a face-to-face probability sample. I'm just going to very briefly show you some of the outputs of that work, and then I'll get into the meat of actually what we've done for our COVID-19 tracker. So if you look at the slides that are now showing for you, the slide that's now showing for you, this is just some of the indicators that we were using our model and our mixed methodology to record. And this particular example is from Uganda, but we actually did our pilot in 8 markets with very similar results to what you're seeing here in the Uganda results. So if you look at what's showing, the first bar, that kind of orangey gold bar, is the FII survey, which is a face-to-face nationally representative survey that we used as our benchmark to compare against. So those are the results we're trying to get the same as using a mixed methodology. The next bar, this darker blue bar, is using SMS alone. So that's a self-complete survey on SMS technology. And our indicators are also about digital financial inclusion. So I'm sure you're not at all surprised to see that the SMS sample, we get a much higher response on the indicators that we were testing. The third bar is using a multi-level regression and post-stratification model to weight our data. And I'm not going to go into the technical details of what's involved in multi-level regression and post-stratification, but if anyone has any interest in knowing the stats of that, you're welcome to contact me directly, and I will help you to get to the right literature and understanding of that. But yes, so the lighter blue bar there is using that model, and you can see with the using that model, we did have some improvement, but there's still an overread on our indicators. So it's not quite enough. And then the next 2 bars are our including some face-to-face in our sample. So mixing the method, so we have a very small face-to-face sample there. In the case of the darker gray bar, there's only 150 face-to-face respondents, and our SMS sample was 1,000 respondents with the model applied. And you can see there that the results we're getting are very, very similar to what you get from a nationally representative sample. And the cost to do this was about a quarter of what it was to do the full nationally representative sample. So we're very pleased with the results, and it was a very successful pilot, so very happy. And the timing of getting this work done, I suppose I don't want to use the word serendipitous because I think the COVID-19 has been a terrible event for everyone globally, but I think it was good that we had been doing all this work and really understanding how do you reach people to get representative samples with technology at this time, because it really gave us a good opportunity to be able to create a survey that could help us in understanding COVID-19. So the idea behind our COVID-19 tracker was really to be able to provide data to policymakers and civil society, as well as business leaders in our markets, that could be used as close to real time as possible. We really wanted to be able to be providing data regularly and as close to the moment as possible to respond to the pandemic in a way that really understood and took into account people's livelihoods. But of course, there's a few things that based on our learnings in the past that we actually couldn't really take advantage of. So the first thing is that we obviously can't include a face-to-face sample. So we've done mixed method work and we're very happy with the results of that, but it's not socially responsible to be sending field workers out into the field at this time. So we can't include in-person surveys. And then because of that, we were very comfortable with the results we were getting mixing the self-complete SMS and face-to-face surveys, but we did know that our self-complete doesn't only exclude those people who don't have mobile phones, but it also excludes those people who can't read or can't read well enough to interact with a survey and complete it on their own. So for this particular work, we opted to go with mobile phones, telephonic interviews alone, and that is the method that we've used. So we had call center agents phoning people to ask them questions.
And Shirley, I want to ask you a question that, one of the concerns that we're hearing about phone surveys, now that you're you're talking about how you conducted the survey for the COVID-19 data tracker, is that one of the concerns is that phone surveys don't really reach the truly underserved. Not everybody has a phone, as you mentioned, and some other challenges, or maybe they have it and restrictions around the use of the phone and so on. Can you also tell us a little bit more about how you mitigated this?
Thank you, Diana. I will definitely do that. So it's actually a very interesting concern, and I think it's something that I've heard a lot. People are very concerned that with the use of telephonic surveys, you cut out a large portion of the population, and particularly the population that is of interest to those of us that work in development. And that's not an invalid concern, but I also think it's not as bad as we think it is necessarily. So on the slide that is showing now, you can see some of the data that was collected in our pilot work that we did with the mixed methodologies. And what we looked for, we used the PPI, so the Poverty Probability Index, in our 8 markets. We used a short form version of that, so 5 questions. And the charts that are showing over Africa there, so there's Nigeria and Kenya and I think it's Tanzania that's showing there. Those show what our sample representation, without any weighting, just what we got was of people living below the poverty line. So you can see there that while we underread these people using SMS and telephonic surveys, sorry, that CATI is a bit jargony, but that stands for computer-aided telephonic interviews, so that's the telephonic interviews. We do pick those people up. So we are underrepresenting them, but they are actually there in the survey. And then we focused in the box on the right-hand side of your screen, we focused in on Nigeria just to look at other particular cohorts of interest. So if we look there at women, we can see while SMS underreads women, we actually get a good representation of women using telephonic interviews. And actually rural as well, the telephonic interviews and the face-to-face surveys, we actually have the same proportions. And then I think the very important figure here from Nigeria that really shows why using telephonic rather than SMS, even though the SMS surveys are significantly cheaper, so we could have potentially gone to more people if we used SMS. This low literacy figure really shows why it's important for this particular work that we used telephonic interviews. And we do certainly, even with the telephonic interviews, underread on people with low literacy, but still a third of our sample are people who self-report that they are unable to read and write. So I think that's quite an important thing to note, that although they're underrepresented, we are actually reaching these people that are often underserved and that are our cohort of interest. And then to really mitigate this problem, we have been very targeted and specific in how we designed our survey. So typically we do probability samples. We're used to using that. It's what we consider to be sort of scientifically accurate. And using telephonic interviews, you can actually do a probability sample, because if you have all the telephone numbers in a particular market, you can randomly select a sample out of that. However, the problem with doing that is that your sample is going to actually skew towards those people who are more likely to have mobile phones. So you will underread on those cohorts of interest, those people who are less likely to have a mobile phone, but are actually people who really are interested in knowing about. So poor rural woman is the kind of obvious example that comes to mind for me. So what we did was we actually designed our sample with specific quotas on people of different groups of interest. So it's not a probability sample, it's actually a non-probability sample, and we're using our sampling method to make sure that we're getting enough people in rural areas and enough women so that we can have those people in our sample and we can analyze by them. And then we are also weighting our data once we collect it to be representative of the national population. So we're not weighting to a mobile phone sample, we're actually weighting to a national population because we're using our quotas to actually try and represent that national sample. So that's a very high-level overview of how we're doing the work. The sample sizes in each market for each wave of data collection are approximately 1,000, except Nigeria, where we're doing 1,750. And just so that you can know what's coming and what's been, we've done dips of data collection. As Michael mentioned, we've got 3 available for Kenya, Nigeria, and South Africa, and Rwanda. And then we very soon we'll have 2 for Uganda that will be available on the website for viewing. Currently, just the first wave of data for Uganda is available. But we are still collecting data in all of these markets, and we have several more waves of data collection, as we call them. Again, sorry, jargon, researcher jargon. And so these are what are coming. We still have another 2 Kenya groups to be collected, and the same for Nigeria and South Africa and Rwanda. And then in Uganda, we have another 3. And in Zambia, another 4. We do have data for Zambia. It will be going up on the website quite soon. And we have just gone live in Ghana for our first wave, and we'll be collecting that there. And then the future dates here, as I've said, are based on estimates. We haven't stuck perfectly to our timelines as we've gone through, but these will be quite similar to what is showing here. So keep an eye on the website and watch the trends and use the data. Please use the data in any way you feel it will be useful and helpful to you. So I think that we have another poll for everyone, if Diana wants to activate that.
Yeah, I hope everybody can see it on their screen. Yes, I see people are responding. If you have any experience with alternatives to face-to-face survey data collection. And thank you for posting questions already in the chat for the panelists. Keep doing so. I see you have a very hard question for Shirley. And we'll make sure we allow some time at the end. All right, so I think I'm ready to close the poll. And then we'll see the results in a few seconds. It takes a few seconds for for WebEx to consolidate the responses. We're almost there. And I think we have the results, which I'm going to share with everyone.
Yeah, I see.
Yeah, Shirley, you're able to see?
Yes, I can see them. Oh, and I see that there is quite a lot of experience using alternatives. Only 22% so far, suppose a quarter have not used any alternatives, but others have. So I'd be very interested if we have time in the Q&A to hear what people's experiences have been like.
Great. Thank you, Shirley, so much. And as I said, we already have a few questions for you to detail some of the things that you shared with us. And now let's take a more detailed look at the indicators included in the tracker with an emphasis on the ones that show gendered impact. So Petronella, over to you for that. Thank you.
Okay, thank you, Dan, and hello, everyone. Thank you so much for taking time to join this webinar. So like Michael mentioned, we've sort of categorized our indicators into broad themes of health, financials, looking at food security, as well as earnings and safety. So the ones that I'm going to mostly focus on are on health, financials, and earnings. And in the next slides, you'll find them highlighted or in bold. So under health, we have indicators which provide insights on people's understanding of COVID-19. That is actually looking at what people think the pandemic is, whether it's a virus or perhaps a conspiracy or a punishment from God. And we're looking at some of their behavioral changes, looking at what people are actually doing to try and protect themselves and their families, whether they're washing hands more or avoiding contacts or large gatherings. And on indicators on access to medicine, we're looking at changes in access to chronic care and also looking at changes in access to sexual and reproductive health items, and also looking at some of the barriers to this access. So obviously before COVID-19, we already had unmet contraception in medical needs in Africa. But with the lockdowns, there've been some disruptions in contraception supply chains and also looking at mobility restrictions and the way this could actually impact on women and marginalized communities' abilities to access services. So these indicators will sort of paint a clearer picture on the impact of COVID-19 in terms of access to medicine. But apart from that, we're also looking at time use indicators, and this give an indication on the distribution of care work. And in Africa, due to social norms, this is normally shouldered by women. But again, with the quarantines, there's an unintended consequence that women will carry the burden on two fronts, most likely them as primary caregivers and also as economic contributors. And in cases where women cannot work remotely, there's also a risk of them leaving their jobs, and this could impact on their labor participation. But also bearing in mind that these lockdowns and quarantines have sort of made people much more aware of the time and effort that is actually put in care work. And this could potentially lead to some shifts in gender roles. And with this tracker, we should be able to get a better understanding of some of the gender dynamics in care work. And I'll now move on to financials, where we have indicators that provide insights on the resilience of different groups during COVID-19, looking at some of the emergency funds during the crisis, where people can potentially get some of these funds, and also if there have been any recent borrowings and the sources of borrowings that people are using, if they've had some missed loan payments and reasons for missing some of these payments. And the other indicators that we have are on government support, which looks at whether people are accessing support from the government and some of their preferences in terms of whether they would rather have the government give them cash or food parcels. And besides that, we're also looking at remittances, where we're looking at the way people are sending and receiving remittances, and also some of the channels that they're using. And then lastly, I'm going to look at the earnings, where we're collecting data on the economic sector of the main income earner, also looking at the hours worked as well as the income earned in the past 7 days. And with this tracker, we're also able to look at some of the incomes and income comparisons from the same period of time with last year. And for those that are interested in farming and businesses, there are also indicators which provide insight on some of the challenges that are being faced. So these are just the ones that I'm going to cover, and Michael will show you more on safety as well as the other indicators that are there. But using these indicators will sort of allow one, especially if you combine it with other data points, to sort of build an evidence base which you can use to inform some of your responses and interventions, and obviously to make sure that we're not reinforcing gender inequalities. I think I'll end there for now, Diane.
Thank you, Petronella, for sharing the indicators and the ones that focus more on gender differentiated results. What does the data tell us so far about the pandemic's impact on women's resilience and economic participation? What can you glean from these first waves of the data that you collected?
Okay, so far we've got 3 waves of data. And what we're finding so far is that the crisis is further reducing the resilience of women to shocks. Taking Rwanda, for example, we're finding that 86% of the women compared to 73% of the men reported that it would not be possible to raise emergency funds in 7 days during the crisis. And we also noted similar trends in South Africa as well as Nigeria, Uganda, and Kenya. And in terms of some of the strategies that people are using to cope in times of financial shocks, we're finding that mostly people are dependent on their friends and family, and that goes across between men and women. But men rely more on their savings as well as regular earnings and selling of assets and putting in more work to increase their earnings. And on the other hand, we're finding that women seem like they're using a wider range of emergency funds or emergency sources. But if you compare now to whether they're formal or not, it's not as much as men. And they depend more on gifts from friends and family, as well as employers getting loans and also getting loans from money lenders and family and friends. So somehow this makes them more financially vulnerable, because for one to keep borrowing like that, you would also need to sort of earn more so that you can pay off some of these debts, and you would need some income to sustain your lives. But again, looking at the Rwanda example, what we're finding is that women are actually borrowing, but they're struggling to pay off some of these debts. And the reasons are around loss of income by themselves and also loss of income by a family member. And another reason that we saw often was that they were prioritizing on other debts. And this is a similar case again in Nigeria, Kenya, Uganda, and South Africa. Though in these countries, the reasons were mostly because of prioritizing on essential goods and also on paying loans. So this shows that women somehow are struggling with income and also with meeting some of their household expenses and in loan repayments. So in order for them to sustain their livelihoods, they need to earn more and they need to pay off some of these debts. And for that to happen, they have to be working, and they also need to expand on their sources of income. But so far, when we look at what the tracker is showing us, is that women are not participating economically as much as men are. And we are observing that men are taking more time with work and also working for longer hours, with the exception of Nigeria, where we found that women are working longer hours. But across the countries, of all of the people that work, we're finding that there are larger gaps between men and women in rural areas as compared to men and women in urban areas, of which in some cases this could largely be a reflection really of some pre-existing inequalities and perhaps some norms around labor participation in care work. And if we look at the time use indicator, we're finding that across the countries again, women are spending more time on care work, and this will potentially have an impact on their earning abilities. And looking, for example, in the case of Kenya, we found that there are not much differences in care time under 4 hours. But as the hours increase, the percentage of women that are actually performing household duties doubles compared to men. And in Nigeria and South Africa, we saw some insignificant differences between men and women for care for longer hours, which could really imply some sort of shift in gender roles, because most of the people are working from home, and there's had to be some sort of sharing of childcare and household duties. But besides social norms, I think the decision on how to divide this unpaid labor will definitely boil down to who's more flexible, who gets paid less, and also looking at the sources of income and perhaps the sector that people are participating in. So in terms of earnings, we're finding out that men received more earnings, since probably because they're also earning more. They're also, working for longer hours and working more. But again, in the case of South Africa, there was an exception where we found that more women actually received their earnings, and this could be explained by some of the relief packages that have been set up in South Africa. And in terms of the average earnings, we see men dominating, including the case of Nigeria, where women are also working for more hours. And of course, for one to really uncover some of these gaps, you would need to also perform more of a deep dive and look at the nature of work, perhaps the industry sector and the job type, and also look at how women are socialized, looking at their competitiveness on the job market and their work experience and some of the work policies. But if we're to look at the economic sectors by gender, what we're finding across the countries is that women are overrepresented in marketing and selling of goods, as well as in services, things like braiding, and most of the sectors which women participating in are actually the ones that are most affected by the lockdowns. And this will likely have devastating impacts on their families, especially looking at female-headed households, which are really sometimes dependent on a single income. So if we're to compare incomes again from last year between males and females during the same period, we're finding that women are not generating income actually, and men have got much less incomes. So I think thinking about this and also performing more analysis will show exactly what is currently happening. And obviously with the other ways that are going to come with data, we will have a much clearer picture. But so far, I think with compromised incomes, as well as an inability to raise emergency funds, a heavy dependence on friends and family who are actually in the same boat where they are also affected by this crisis, and everyone is really trying to tighten on their pockets, looking at failures to meet debt obligations, more care work. We can see at the moment that so far this pandemic is negatively impacting on women's resilience and also on their economic participation. I think I'll pause there for now, Diane.
Thank you so much, Petronella. And they are very, very interesting findings. And I think some of the questions that we've been receiving in the chat, maybe you've already answered. But I would like to invite everyone to continue to post their questions in the chat box, and to remind that the presentations and the recording of this webinar will be shared with everyone. So you will receive the slides and the recording of the webinar, and again, written answers to all the questions that we may not get to today, as we're running a little bit short of time. So we'll allow for maybe 5 to 8 minutes of Q&A, so that we have at least 5 minutes for the data portal demo for the ones interested in staying with us for that. So the first question, Petronella, since you're still on the mic, we have a question whether there are any indications of changes in the main income earner in the household. Have you seen, if you're tracking, have you seen any of that, how the main income earner in the families have changed? And then also a question that maybe you can answer, Petronella, is whether are you tracking how savings groups have been affected by COVID? Are groups still existing, functional, or what's happening with those?
Thank you, Diane. On the indicators of, sorry, the question is, what are the changes in main income earner in households? Did I get?
Yes, the income earner, exactly.
Okay.
If there are any changes, if you've seen any changes, any indications of changes in who is the main income earner in the household.
Okay. So at the moment, we haven't seen that, but one can actually look and see if there's been any changes when it comes to the sector that the income earner is in, or any changes in sources of income. So that is what we currently have. And yeah, I'm not sure if I've answered that completely, but obviously, in terms of the questioning, we do not have a specific question that says, have you changed from being the main income earner? But it simply shows whether the sector has changed and also whether there have been any loss of income from the main income earner. And in terms of savings groups, I think we don't have a specific question that asks whether someone is in a savings group, but actually on sources of funds, whether they're getting that from a savings group or not.
Thank you, Petronella. I would like to read out a question that probably Shirley will be best placed to answer. What constitutes SMS modeling, and whether these results suggest that SMS alone is superior to face-to-face? I think this is probably related to earlier in the presentation, Shirley, when you discussed a little bit of your experience with addressing those challenges.
Thanks, Diana. I did see that question. So I'm going to address the second half first. SMS alone is definitely not superior to the addition of face-to-face. It's a lot better in terms of bang for buck because it's very affordable, but in terms of getting to your representation, it is definitely not better than including some face-to-face. And then talking about what constitutes the SMS modeling, what we did was we used a regression model called multi-level regression and post-stratification. I myself am not a statistician, so I can't explain it in a very good way, but essentially it is a model that uses, it goes into the real depths of different cells or interlocks of people in your sample. So what I mean by that is it'll look at women to the point of sort of women who are living in rural areas and are aged 18 to 25 could be one of the cells of interest for you. And if you don't have enough people to represent those people well, it borrows strength from what we call neighboring cells. So it borrows strength from, it'll model your results based on people who would be very similar to women who are aged 18 to 25 living in rural areas. So in that case, it might use the results from women who are aged 25 to 35 living in rural areas to help to predict what the answers of people aged 18 to 25 would be. So it's a way of weighting the data, but it goes into very, very minute detail and borrows strength across cells. So it's really good for weighting data that you might be missing people of interest.
Great, thank you. And I'll read out one question for you, Shirley, whether you have any experiences with multi-level regression and post-stratification for a subset of the population. So not trying to make it national representative, but rather using it for a correction for surveys focusing on the low-income segment, for example. And before I let you answer that, there was another question of how granular the data gets, and you will be able to see that in the demo that Michael will do in a few minutes. So we'll not answer that live. As you'll be able to see that shortly.
Those are two actually very good questions. I myself have not had any experience using, I'm going to call it MRP, multi-level regression and post-stratification. I haven't had experience using MRP for subsets of the population, but because we've had experience doing so for a national population, I would imagine that it will actually be even more successful for subsets. And what I can say about it is what really gives it power is that when you want to do analysis on your smaller subgroups, it actually strongly improves the error margin within that subgroup versus just doing a normal weighting. And that does actually talk to also the level of granularity of this current work, which I will jump in a little bit on. I know that Michael will go into a lot more detail. What's currently available on the website is not weighted using MRP yet. We are still in the process of working with that, and what is there is actually rake weighted currently. So what I would recommend with that is not to go into too much granular detail or to take too much, to put too much onto very small groups within that. Looking at big groups like men and women, I think is absolutely fine, and urban and rural is absolutely fine. But as we get to smaller groups, your margin of error will grow quite significantly when looking at what is currently available. We are working on looking at what the MRP results, the difference that we get there, and what that means for error margins, and how we can use that to get to more granular analysis. And so watch this space. And then I also actually very quickly wanted to jump back to the question posed to Petronella on main income earners in the household. I can't tell you the insight on that, but what I can tell you is we do have a question in the survey that is what your relationship to the main income earner in the household is. So looking at that over time would actually be able to give an indication of if there are shifts within households as to who is the main income earner. So, sorry, I just wanted to add that too.
Anna, just a quick note that if you're speaking, we can't hear you.
Sorry, my connection has been going in and out at very critical moments. But thank you, Shirley, for that. And I think if we can ask Michael now to show us in 5 minutes a live demo of the data tracker. Michael, I think I made you presenter, so you can share your screen, I believe. And thank you to everyone for sending us the questions. So we'll use now 5 minutes to show you the actual website and how it works, and then we'll close. Thank you, Michael.
Diana, can you see my screen there? Is it showing up on your side?
Yeah,
right.
I can see it. Thank you.
All right, so on the COVID tracker itself, I said the URL earlier in the first presentation. There's the URL for those that didn't get that. We'll share the presentation afterwards as well. So once you go to the COVID tracker website, you'll land on this page. I'm just going to go quickly through the navigation. So top line indicators, those are sort of PowerPoint presentations just with hard indicators, insights, resources. Those are blogs, infographics, videos, anything that's resource-based. You can subscribe, so whenever we update the data with new waves, you can just put your name and email there. We'll notify you on the latest updates. And if you choose to download the data directly, you can just click the download, put your name and your email, and a download link will get sent to you. Let me just cancel that. All right, so then that's the COVID tracker. You select which country you want to see. Zambia and Ghana are still coming with other waves. I'm going to select the first one, which is Kenya. So that's the landing page there. On this Kenya, it's a quick, so we took usability into account here. So if you want to jump countries, you can quickly jump countries through this drop down. These are the main categories that myself and Petronella mentioned. It's there for this exercise. I'm just going to use summary. Summaries is a couple of widgets from each category, and I'm going to filter it. So I'm going to use women and rural. That seems to be topical in this webinar. And the data is going to get filtered by these indicators. So based on women, rural, for Kenya, under health, we have the following. So this is the timeline, wave 1 to wave 3. If you mouse over, you start getting the sort of helpers. So for understanding of COVID, for women rural, the top one, which is light blue, is 49% was in wave 1, 62% wave 2, and 65%. So obviously with the waves, the understanding is getting a lot higher. This is another sort of understanding. This is what Petronella mentioned with the weapon. Is it a conspiracy? Is it a punishment from God? You can see the percentages there broke down into the waves. We're moving down to the next widget, the understanding of COVID-induced behavior changes. So what sort of changes is it induced? Top one being washed hands. So when the lockdowns and all of that kind of started, it was on 88%, and then it became 92% with washing hands. What's interesting here is obviously a face mask and the relevance of it and how it's jumped with the waves. So black is the wearing of a face mask. The next is social distancing. So these are a couple of indicators involved there. Limit contact with people, stay at home more, go to work less, travel outside of home less, avoid big crowds. I'm just going to work with the top two. So you're looking at the teal, and which is the highest, which is limit contact with people and stay at home more. Changing chronic care. This is also based, all the data is based on women and rural, so just keep that in mind. So this is wave 1, yes, being the dark blue, and the lighter blue being no. Access to required medicine. So you guys can go to the website and play around with yourself. I've only got 5 minutes or 2 minutes left. We can jump to, say, a financial one. Emergency funds availability. So black being not very possible, and yellow being not at all possible. So you can see how with the waves, how not possible it becomes. And then with future waves, you'll start getting the bigger picture in mind. Recent borrowing, so dark blue being yes, light blue being no. And then in the beginning, people weren't very borrowing. And then obviously with the waves going down, the borrowing gets kind of more. Well, that's the sort of insights I'm drawing from it. And then if you find that this sort of widget to be interesting, you can select share, and you can copy this link and you can post it on your social channels. Or you can just select the button up front. So if you want to post it on Twitter, just select the Twitter icon and you can share it. You can email it to a colleague. You can post it on LinkedIn as well. And if you wish to embed this widget, you'll just copy the code and go to your website in WordPress, whatever the case is, you can paste it in there and share it. So missed loan repayments, yes being the dark blue and light blue being no. Difficulty accessing government support, and the same thing applies here, yes, the lighter blue. And then with wave 1 being yes, 19%, and then it jumps to 30% in wave 2, and it jumps to 32% in wave 3. This is for food security. Remember, the summary is only using a couple of indicators. So if you are interested in, say, the food security, I would suggest going into the category as a whole and seeing all the indicators available. But this is a series of webinars, so hopefully with the next webinar, we'll have more waves, and then the picture will be a lot clearer as well. So relative food availability. So, sorry?
No, yeah, I was going to say it's just the first webinar.
Yeah. And then, you guys can play around with it. I think my time's up there. I can go into detail.
Thank you, sir.
Time's the issue.
Yeah. Thank you, Michael. This is really helpful. Yeah, time is up. Thank you so much for giving us a flavor. Again, I think this was really helpful. And as I mentioned in the beginning, this was the first webinar. We covered a lot on the methodology, what data you can expect, and what kind of insights we were able to see so far. And the future webinars, as soon as before the end of the month, we're hoping, if not early July, to continue with a couple more webinars to go a little bit deeper into what the data is saying within the insights. So please stay tuned to register for the future webinars. I would like to thank you so much. Thank you, our speakers, for coming today and sharing the information with us. I know it was a lot, but very interesting. And if you don't mind, I would like to ask to answer this feedback survey that will help us organize future webinars and tailor them a little bit more to your interests. And just to summarize that the presentation, the slide deck, and the recording of the webinar will be shared in a couple of days, and any questions that we were not able to answer live will be sent to you. The responses will be sent to you in writing. So thank you very much for joining us today. Thank you to the presenters, and stay tuned on when a future webinar will be hosted towards the end of the month, early July. Thank you very much.
Thank you.